Hello. So today we are going to talk about regenerative therapy in chronic pain management. I am Dr. Manas Manohar, consultant pain physician practicing at Poona hospital. So we get a lot of patients who ask us, "Sir, doctor, what is this regenerative therapy? How does it help in chronic pain? What are the conditions it is useful in? What exactly do you mean by regenerative therapy?" So what happens is that a lot of patients coming to us are suffering from low back pain. They are suffering from tendinopathies like common conditions, tennis elbow, golfer's elbow, plantar fasciitis. So basically, regenerative therapy helps in all these patients who are suffering from musculoskeletal injuries, as we call it. So the commonest form of regenerative therapy that we use is the PRP, which is platelet-rich plasma, wherein we take certain amount of blood from the patient. Immediately it is processed, as in the blood is taken and centrifuged as per the condition, depending on how many ml of platelet-rich plasma we need. After processing, we generally get the blood is separated into its different layers. So the layer of blood which is rich in platelets is what we aspirate and then inject at the site of the pain. So for example, if somebody is suffering from tennis elbow, so certain ligaments or certain muscles over here are damaged, or there is a certain amount of inflammation over there, certain amount of degeneration because of overuse is there. So we take the blood, process it, collect the platelet-rich plasma part of the blood, and under image guidance, usually ultrasound, we inject it around the muscles or the tendons which are affected. So this not only is a kind of a natural way of healing the tissues, because it is your own blood which we are using. It gives sustainable and long-lasting results, and since we are using your own blood and the procedure is done under aseptic precautions, it is completely safe and there are very minimal side effects. Similarly, this can be done for early degenerative changes of the knee, wherein we remove the blood, process it, and the platelet-rich plasma is injected in the knee joint. Similarly, for the shoulder. Now, shoulder is a joint which is used very often, and we get a lot of patients who have tears in the shoulder ligaments. So again, after processing the blood, we do it under ultrasound, see under ultrasound, and inject in the affected area. So one more question that we often get asked is, how many sessions, doctor, do we need of this therapy? So again, it depends on what injury are we looking at. If there are certain tendinopathies like tennis elbow, plantar fasciitis, or the heel bone pain, in those conditions, generally one sitting is enough. But if we are looking at degenerative conditions like osteoarthritis of the knee joint or osteoarthritis of the shoulder, then probably 2 to 3 sittings are recommended. So this was about platelet-rich plasma. Now there are certain advanced techniques which are also coming up, wherein we use the serum from the patients. Like, it does not contain any platelets or any RBCs. It is just the serum part of the blood, which is rich in cytokines, which is rich in anti-inflammatory proteins. So that serum is just taken out, as in the blood is taken out, it is processed, and only the serum which is rich in these anti-inflammatory agents is taken and injected in various parts of the joints where we need a healing process. This can also be injected into the spine to treat conditions like lumbar canal stenosis, or chronic degeneration of the spine, or chronic sciatica types of conditions. So these are the common things that we are doing at pain clinics, and regenerative therapy is definitely helpful in select patients. So thank you for your patient listening, and you can type in comment box if you have any queries. Thank you.